And so this is very similar to a linear model where we have variables and those are multiplied by weights and then they are summed up together. The one difference here is we're then taking the exponent of that, and it's not very important to understand why we're taking the exponent of that, except that this helps make sure the output is always greater than or equal to 0. And we can then multiply that by the baseline hazard. And we can use this model of a hazard to determine what are the relative risks of patients. For example, if we had two patients, patient 1 and patient 2, and patient 1 had the following characteristics. They were 50 years old and they smoked, and patient 2 was 30 and they did not smoke, then can we compare the relative risk of patient 1, which is represented by the hazard, with the relative risk of patient 2? And so we're not going to show the slide. And so let's try to compute what that risk would be given this model. So we have the hazard for patient 1 be the baseline hazard, or lambda naught of t, times x of 0.08, which is the weight associated with being a smoker. Now we know this patient is a smoker, so we have a 1 indicating that this patient smokes, plus 0.01 times the age of this patient, which is 50. And this is going to come out to, we're going to keep the lambda naught, and this is going to be x of 0.08 plus 0.5, so this is 0.58. And this comes out to lambda naught of t times the factor of 1.79. And so this is what we're going to keep as the risk for patient 1. So remember, this is the baseline hazard times a factor, which has come out to 1.79. And we can do the same for patient 2. So the hazard for patient 2 is going to be the baseline hazard times the exp of 0.08. Now this patient is not a smoker, so we'll have here a 0, and then we'll have plus 0.01 times their age, which is 30. And this simplifies down to lambda naught of t times exp of 0.3. And so this is lambda naught of t multiplied by a factor of 1.35. So there we have computed the risks for patient 1 and patient 2.